Good afternoon. Faculty, please be seated. On behalf of our entire school community, 400 faculty and staff, 1,200 students, 18,000 alums all over the world, welcome to the 81st commencement ceremony of UC Berkeley School of Public Health. My name is Michael Liu. I'm the dean of the school. So first, I just want to say how proud I am of each and every one of our graduates. Let's give it up one more time for this amazing class of 2026. I love commencement. It's one of those moments that you'll remember for the rest of your life. You will forever remember the pomp and circumstance, the walk across the stage, this glorious afternoon when the entire brilliant class of 2026 is together for one last time. But the one thing I guarantee that you will not remember is the dean's speech. If you don't believe me, let's ask the audience. For those of you who've been to a commencement before, raise your hand if you remember what the dean said. That's what I thought. So for the past few weeks, I've been fretting about what I'm going to say, refusing to go down as yet another dean whose speech nobody remembers. Now, before COVID, I could do just what other public health deans did at commencement, which was to spend most of their allotted time answering the one question that many in the audience had, but were too polite to ask. What do you do with a public health degree? Well, thank God I don't have to do that anymore. If there's one lesson we learned from COVID, it is that the world needs public health. In fact, your timing is impeccable because you're going into public health at a time when the world needs public health more than ever. When you think some of the biggest problems facing the world today, when you think of some of the greatest existential threats facing humanity in the 21st century, climate change, infectious outbreaks, chronic diseases, social inequality, these are all problems that require public health to be front and center in driving solutions. In fact, I can think of no higher calling, no nobler profession, nothing that's going to save more lives and alleviate more suffering in the coming decade than the profession that you're about to go into. But then I'm not telling you anything that you don't already know. So I thought, well, maybe I could just throw a bunch of unsolicited advice at you and hope that one sticks. And believe me, as a Taiwanese American parent, I'm pretty good at giving unsolicited advice. But I just wasn't quite sure how inspiring it would be for me to be telling you at commencement that the ratio of water to rice in a rice cooker should always be 2:1, or that that blue and gold is always a better look than cardinal red. So I turned to a trusted source of advice that many commencement speakers turn to, called the internet. And it turns out that there's actually a lot of good advice out there. I like this list from Jake Tapper of CNN. Be nice to seniors, be nice to children, remember birthdays, never miss an opportunity to charge an electronic device. Use two-step verification, stretch before exercising, stretch after exercising, just exercise, and never pay $200 for a pair of jeans. Great advice, but unfortunately, not mine. So over the past few weeks, I had to dig really deep to find the one thing I could say that might stay with you. And after a lot of soul searching, this is what I came up with. Don't ever let anyone tell you that you can't change the world. changing the world. That's why most of you came to Berkeley Public Health in the first place. You want to learn how to make the world a better place. You want to help change the world. And over the past few years, our faculty and staff have worked really, really hard to give you the knowledge, tools, and skills you need to go out and change the world, to help you develop that sense of agency as a change maker in the most supportive, most nurturing environment. But once you leave here tomorrow, things are going to be different. Not everyone out there is going to be rooting for a change maker. There are going to be cynics and skeptics who will tell you that you can't change the world. There are going to be bosses and colleagues who will tell you that to stay in your lane, don't rock the boat, and don't make waves. There are going to be doubters and haters who will harass and intimidate you for speaking truth to power. And there are going to be dark days ahead when you feel like nothing you do matters, when you feel like just giving up on the good fight for health equity and social justice for all. In those moments of doubt and despair, I hope you will remember this one thing. Don't ever let anyone tell you that you can't change the world, because you can and you will, especially if you remember these 3 pieces of unsolicited advice from your dean. So first, if you want to change the world, don't be afraid to challenge the status quo. Refuse to accept the world as it is. Dare to imagine what it could be. Challenging the status quo. That's what Berkeley is all about. It's who we are. It's in our DNA. From the free speech movement to all the anti-war protests, to our 63 Nobel laureates and counting, and to all the powerful ideas that changed the world. It is no accident that 2 of the most transformative ideas in medicine and public health over the last 100 years, social determinants of health, community-based participatory research, were born right here at Berkeley in our school. So what makes Berkeley so special? I think because we dare to think differently, to think outside the box. We dare to challenge conventional wisdom, to challenge the status quo. So class of 2026, the last thing I want to see is for 572 Berkeley Public Health changemakers graduating from the #1 public university in America, armed with the knowledge and skills to change the world, to go into the world only to settle for the status quo. So as you leave here tomorrow, whatever you do and wherever you go, I want you to promise me just this one thing. Be the last to accept the world as it is. Be the first to ask, how can we make it better? Be the last to accept inhumanity, injustice, inequality as inevitable. That's just how the world is. Be the first to roll up your sleeves and do something about it. And to paraphrase Robert F. Kennedy, the good Robert F. Kennedy, when you see wrong, be the first to try to right it. When you see suffering, be the first to try to heal it. When you see tyranny and war, be the first to try to stop them. Because the world will not change from the sidelines. It changes because people like you, who refuse to accept what is, dare to imagine what could be, and then fight like hell to make change happen. Second, to quote the late Congressman John Lewis, don't be afraid to get into some good trouble. Public health is not for the faint of heart, especially these days when standing up for diversity and equity can get you targeted and defunded, when standing up for science and public health can get you vilified and harassed, when standing up for human rights and justice can get you deported and murdered. But if you want to change the world, you have to be willing to get into some good trouble. Now, getting into some good trouble takes practice. It takes practice and courage. The courage to speak up when silence feels safer, to stand by your values when others genuflex, to stand up for the most vulnerable even when your knees are shaking. It takes practicing resilience, the resilience that lifts you up whenever the world knocks you down, that finds a way out of no way and makes the impossible possible, that endures defeat but is never defeated. And it takes practice in hope. Hope is an daily act of resistance against cynicism and despair. Hope is the refusal to give up on a future worth fighting for. Hope that turns our darkest days into our finest hours. In the words of my favorite boss, President Obama, hope in the face of difficulty, hope in the face of uncertainty, the audacity of hope. And in the end, that's what it will take to change the world, by practicing daily courage, resilience, and hope, and by getting into some good trouble, necessary trouble. And the last piece of unsolicited advice is this: find your redwoods. All right, remember the question I asked at the orientation about redwoods? Well, of course not. Nobody remembers the dean's speech, right? But this is what I asked. Why do redwoods rarely fall despite having very shallow roots of only 6 to 12 feet deep, even though they can weigh hundreds of tons and soar hundreds of feet into the sky? The answer? The roots. Right? The roots reach outward and intertwine with other roots from other redwoods around them. In other words, they hold each other up. So take a look around you. These are your redwoods, your family and friends, your classmates, teachers, your mentors, and all of us here at Berkeley Public Health, 400 faculty and staff, 1,200 students, 18,000 alums worldwide. We are your redwoods, rooted in common purpose, bounded by shared values, a community of public health innovators, change makers, and arc benders, fighting every day to bend the arc of the moral universe toward health equity and social justice for all. And as you leave Berkeley tomorrow and go to all the places you will go, you will need to find your redwoods. People who will keep you grounded. People who will inspire you to greater heights. But more importantly, spread out your roots so that others can hold on to you, that others can draw strength for you. Be an anchor to other redwoods, especially those who are most vulnerable, most at risk of being uprooted, most in need of someone to hold them up. Because if each and every one of us, by spreading our roots from redwood grove to redwood grove, from community to community, from nation to nation, we will create something far greater than ourselves, a network of root systems spanning the world, intertwined, unbreakable, holding each other up, and that's how we're gonna hold up health equity and social justice for all, and that's how we're gonna change the world. So in closing, it has been an absolute honor to serve as your dean. I hope you never settle for the status quo. I hope you get into some good trouble. And wherever you go, I hope you find your redwoods. People who will hold you up just like we always will. People who believe that you can and will change the world just like we always have. And yes, please remember birthdays, change your passwords often, always use two-step verification, and never, ever forget this, that blue and gold is always a better look than cardinal red. Congratulations, graduates, Fiat Lux, and go Bears. Now to our main speakers. We have a tradition at Berkeley Public Health of lifting up the voices of our incredibly talented students. This year, we have selected one graduate student and one undergraduate student to share a few words of reflection and inspiration with you. In the interest of time, instead of reading their bio, I will refer you to the program. This year, I'm pleased to announce that our undergraduate student speaker is Misha Afnani. And Misha will be followed by our graduate student speaker, Bhavya Joshi. Please join me in welcoming our 2026 student speakers.
Good afternoon, graduates. It's hot, huh? To our distinguished guests, faculty, friends, and family, I want to give you a warm welcome to the UC Berkeley Public Health Commencement Ceremony for the class of 2026. My name is Misha Afnani, and I am thrilled to be the undergraduate student speaker today. I want to start off by saying that I stand here as an Iranian woman on behalf of all the women in Iran who are fighting for their rights, and have been fighting for the past 47 years. Their right to education, their right to free their hair, their right to be equal, their right to dance, to sing, to laugh, to live. As a proud daughter of 2 immigrants, I was lucky enough to have parents who gave me the chance to live without fear, to be bold, to challenge the status quo, and to pursue every goal I had in this life. And when it came time to choose a college, that is exactly what I was looking for. UC Berkeley is unique in that it pushes students to be change makers in their fields, to make mistakes and come back 10 times stronger, and to show up as fierce, unapologetic individuals in everything they do. I remember my first day at Cal. I had no idea what was in store for me. I also had no idea that I'd be walking 30,000 steps up and down these hills all day, every day during GBO. Everyone knows UC Berkeley as the amazing world-renowned institution that it is, and I was worried about where I was going to fit in. Until SPUG departmental emails started rolling in, and I was surrounded by support before I even knew I needed it. Drop-in advising, weekly newsletters, peer advisors, mental health resources, research and volunteer opportunities. And I slowly realized what made Berkeley so special. Not just the groundbreaking research that is done here, but the students themselves, backed by faculty and staff who genuinely invest in them. That supportive environment, the community they create so you have a village behind you as you navigate this huge school, that is public health. Quoting the late Prophet Baha'u'llah, "The betterment of the world can be accomplished through pure and goodly deeds and through commendable and seemly conduct." Most people, when I tell them my major, automatically assume that I'm just studying medicine and tell me I'm going to be a great doctor. And when I say, actually, that's not really exactly what I study as a public health major, they ask, what do you study? And I always say, well, everything. How the environment down to the zip code you live in affects your health outcomes. How clinicians spend less time, build less rapport, and provide fewer explanations to patients with low socioeconomic status. How 2 towns just 30 miles apart could have a 15-year difference in life expectancy. What I'm describing, as I'm sure my fellow graduates recognize, are the social determinants of health, the very core of public health. And our graduating class is filled with students who work upstream to get to the root of all these public health issues. Advocates who use their research to drive change, champions of social justice, and future policymakers who will work towards making this complex system more fair and more equitable. And they know that true progress in public health means the system starts working even for the people that it was never designed for. So, I don't know about you, but I don't think there's any profession more pure or more commendable. Now, I want to acknowledge the world that we are stepping into after leaving this campus. The public health landscape is shifting and it can feel uncertain. watching funding get cut, seeing hard-won policies challenged, and feeling like the very systems we dedicated our education to improving are under attack. I know many of us have felt that weight, but then I look into this crowd of people, and I remember that change has never come from perfect conditions. It has always come from people who care enough to choose discomfort over silence, and as I see this graduating class, I see future leaders who refuse to look away from the inequities in front of us. The road ahead will not be easy. There will be setbacks. There will be moments where we are discouraged, but the work that we will do will outlast any one setback, any one policy, and any one administration. Before I close, I want to take a moment to thank my family. To my mother, Naseem, you're the most remarkable woman I know, and I could not do any of this without you. To my father, Sasan, you are an extraordinary man and someone I look up to every single day. The two of you have been the most exceptional parents to my sister and I, and every achievement in my life is owed to you. Now, I want to ask my fellow graduates to stand if you are able, and please join me in giving a huge round of applause to our staff, faculty, and professors for their dedication to helping us succeed. Thanks, guys. Another round of applause for our friends and family for their unwavering support. And lastly, a round of applause for all of you graduates. I am beyond proud of every single one of you and your brilliant minds, and I am most grateful that I get to graduate by your side. Congratulations, class of 2026, Fiat Lux, and go Bears.
Thank you. Namaste. Good afternoon, graduates, distinguished faculty, guests, families, and friends. Communities are drivers of change, agents to dismantle the status quo, are continually shaping the social fabric and defining the public in public health. 5 years ago, I opened my statement of purpose with those words. They were not just a thesis, they were a conviction deeply rooted in the understanding that communities are not the backdrop of public health work, but they are the beating heart of it. My name is Bhavya Joshi, and I am graduating today with a doctorate in public health alongside my incredible cohort mates and colleagues. So let's give it up for the class of 2026, everyone. I was born and raised in Delhi, India, a city that has organized chaos and breathtaking energy all at once, where the scents of spices and curries drift through every street, where community is not a concept you study, it's the air you breathe. India, a country that gave the world yoga, Ayurveda, and turmeric long before wellness became an industry. And yet, it is also a country where patriarchal practices and gender inequities are deeply rooted. I was not exempt from this. Growing up, I encountered the same structural inequities and gender biases that I would later study in textbooks and measure in data. the quiet but persistent weight of a society that decides long before you've spoken a word how much space you're allowed to take up. As a young adult, I quickly understood that with these circumstances, one must be determined and focused on one's goals and dreams, else it could be a swift burial under the social and cultural weights. At the cusp of decision-making, I turned to my community, to my grandparents, aunts and uncles, sisters and brothers who invested in the lower middle class girls' improbable dream to pursue higher education abroad, to my parents, who stood by radical decisions and supported them when I needed it the most, and to my husband, who held steady when I could not. This degree belongs to all of us, especially to my mother, who made the quiet but revolutionary choice to refuse to pass on the very structures that once confined her and invested in her daughter's dreams. Happy birthday, Mom. And that choice made me not only the first generation student, but today it is the first time ever in the history of my family that a doctoral degree enters the family. But my mother is not alone in that choice. Across communities and generations, there are women who look at girls around them and decide, not her. Women who choose to uplift rather than limit. It is on the shoulders of many such women in my journey that I stand today. And it is in their honor that I walk out of this room committed to doing the same for women around the world. Which brings me to all of you. Every person in this room has a version of that story. Someone who refused to let the world's limitations become yours. Who held the door open or held you together when you needed it the most. So my first invitation to all of you is to lean in, lean on, and lean into your community. Take a moment to thank the people who made us and who got us here. The faculty that sharpened our thinking, the staff who kept everything running often invisibly, the mentors who saw the potential in us before we could, the peers who became our thinking partners and late-night study companions, and the families and friends who held space through every deadline and every doubt. This degree belongs to all of us. We are graduating in a world that feels more divided than ever, in a world that has learned to profit from othering. So whatever comes next, protect each other, speak for each other. The courage that brought you into public health is the same courage the world needs from you right now, so hold on to it. My second invitation is to not give up on public health, even when the systems around us might try to convince us otherwise. The past years have dealt serious blows to public health. The dismantling of USAID, the disruption of funding, the erasures of programs, colleagues who dedicated their careers to this work losing their jobs. It is painful. It is enraging, but it is also a call to action. Across the world, wars and conflicts are displacing millions, dismantling health systems, and creating the very conditions of vulnerability that public health exists to address. Gaza, Sudan, Myanmar, the list goes on. Conflict is one of the most significant determinants of health in the world today. But here's the good news. Our training, every methodological debate, every passionate discussion, every humbling moment of realizing how much more there is to learn was preparation for exactly this moment. We were never imposters. We are the people who said yes to the most difficult, most necessary work of this era. From cholera to smallpox, from HIV/AIDS to COVID-19, this field has a history of doing what seemed impossible because the alternative was unacceptable. The alternative remains unacceptable. So I leave you with the words of Audre Lorde, a Black feminist poet and activist. When I dare to be powerful, to use my strength in the service of my vision, then it becomes less and less important whether I'm afraid. Congratulations to the graduating class of 2026. This girl from Delhi, who was still learning how much space she was allowed to take up, found her answers here, in this field, in this community, and in all of you. Let us continue to find in each other and ourselves the courage, the compassion to keep public health not just relevant, but indispensable. Thank you so much. Fiat Lux and Go Bears.
Thank you, Bhavya, and thank you, Misha. I hope you can see why I'm so proud of this courageous class of 2026. Let's give them another big round of applause. Each year at commencement, we honor a faculty member for their distinguished record of mentorship with the Zach Sabry Mentorship Award, named after one of the most legendary mentors the school has ever had. This year, I have the honor of presenting this award to two very special faculty members, Drs. Coco Auerswald and Dr. Andrew Mertens. As Coco and Andrew come to the podium to receive their award, please take a moment to read all about their accomplishments in the program, and let's give them both a big ovation as well as to all of our incredible faculty of UC Berkeley School of Public Health. I would now like to invite the current president of our Public Health Alumni Association, Tia Gangapade, to join me at the podium to present the next award. This year, we're honoring Dr. Joseph O'Neill, UC Berkeley class of 1983 MPH. Dr. O'Neill was former director of the White House Office of National AIDS Policy under President George H.W. Bush, founding director of HIV/AIDS Bureau at the Health Services, Resources and Services Administration, and the chief architect of the President's Emergency Plan for AIDS Relief, or PEPFAR, which to date has helped save 26 million lives all around the world. Let's welcome Dr. O'Neill to the podium.
We're JMP graduates, right? We should be able to get this, at least this much, right? Good, thank you. So, thank you for letting me be here. It's been quite some time since I've been on this campus. Now, I'm looking there, okay. I'm not used to the So I've one, if you take nothing else back from what I have to say, the most important thing to know to have a very successful career is to be at the right place at the right time. I want to thank you for this award, but more importantly, I want to thank you for the education that I received here at UC Berkeley. That includes the Public Health School. I'm also a graduate of the Business School here. I'm a graduate of the UCSF-UCB Joint Medical Program here, so I owe the taxpayers of California a lot. I also want to say thank you to the other institutions around the world that have tried to drum some knowledge into my head, and that includes City College of San Francisco, San Francisco State University, the University of Washington and Johns Hopkins that taught me some clinical medicine, and the University of Cape Town in South Africa that taught me, and because I was there, taught a lot of people in Washington that African universities and universities around the world can do a damn good job of education. So thank you. President Bush used to call me the architect of PEPFAR, and as was mentioned, that's probably saved over 26 million lives now. This is what I mean about being at the right place at the right time. I don't take credit for any of that. I was at the right place at the right time. The credit for PEPFAR goes to no one other than George W. Bush. It was his idea. He pushed through, and it was a privilege for me to work for him and make it happen. But it was also thousands of other people who worked in anonymity and in humility to make it all work. One of them is sitting here as your chancellor, and her husband and other people. So that's where the credit goes. I just happened to be lucky enough to be at the right place at the right time. So imagine this, you're graduating today, and this was my story. Exactly 20 years, almost to the day of my graduation from Berkeley, I found myself in the Oval Office with the President of the United States for what was supposed to be a 5-minute meeting and ended up being about an hour-long meeting. And the question that he asked me when I walked in was, do these new AIDS drugs really work the way they tell me they do? And I could say, because I was on the faculty at Johns Hopkins and worked in the AIDS clinic, again with a lot of people that we know together, I could say, Mr. President, I can look you in the eye and tell you that I have seen my patients turn away from death's door and go back to their families and their lives. These drugs work. We talked a lot about, and again, that's what I mean, it wasn't just one person, it was all the research and the work of public sector, private, making this thing happen. And I talked a lot about my experience clinically. I was surprisingly interested in what it was like to be a doctor and doing this work. Also my experience of helping to design and set up the Ryan White Care Act programs in the United States. And I was proud to be the first director of that entire program, and I worked a lot with Senator Kennedy's staff and Congressman Westmoreland's staff and a lot of people on both sides of the aisle to make that happen. At the end of that conversation, President Bush looked at me and he said, "You're not telling anybody about this. Number two, I will get you," now remember, you're 20 years out from school, "I will get you however much money you need to turn the epidemic around in Africa. But do not come back in here and tell me just to write a bigger check." And I took those orders, and that's how I ended up being the director of the White House Office on AIDS Policy. What I want to say, I'm not used to working with a teleprompter, so I'm still a little confused, bear with me. So that appointment made me one of the first openly gay or lesbian men or women in the United States to serve on a White House council. Now, White House Council, I was on the Domestic Policy Council, and I'll come back to that, but that's the National Security Council. That is it made me a personal advisor to the president. And that created pretty soon a problem for me, and that's what I really want to focus on for a minute here. In 1996, President Clinton signed the Defense of Marriage Act, which made gay marriage illegal in the United States. That was, there was under, for reasons I won't get into, there was a tremendous amount of pressure on the White House, on President Bush, and from some of the people who were the strongest supporters, who became the strongest supporters of PEPFAR, for him to propose and support a constitutional amendment to gay marriage, banning gay marriage. So imagine my position in this very visible role as an openly gay man advising the president on his domestic policy council where gay marriage is becoming discussed. I talked to him privately about it, and when I'm dead and gone, in my safe deposit box, somebody will find a handwritten letter from him discussing this and his reaction to my discussion with him. But I couldn't say anything. And so I was crucified by most of my, quote, community. And I get it. I'm in the White House and gay marriage is being discussed as something to be banned. The President Bush is sending signals that he might move, and he did move to propose a constitutional amendment against it. And I was accused of being a coward. I was accused of being overly ambitious, a traitor to the community. I lost many, many friends who wouldn't speak to me, many people who were my academic colleagues at Hopkins. And of course, when the 2003 State of the Union address was made and President Bush announced the $15 billion to go to address AIDS in Africa and around the world, suddenly I became a hero again because it was clear that I was very involved in making that happen. I was forgiven my sins. I was brought back into the community. I wish I would say I was a big enough man that I forgave theirs, but I haven't. It was a very, very tough time. So my point in telling this story is this. I had to choose between two issues that I felt very strongly about: my right to get married and rights of people in Africa and around the world to live. And it was clear to me that it became clear to me as I thought about it that my feelings about same-sex marriage did not outweigh my feelings about the sacredness of human life and saving lives. And I knew that if I, to quote Dennis Prager, I had to decide what would I die for. Would I die to protect gay marriage? The truth is I wouldn't. Would I die to protect millions of lives around the world? The answer is that I would. But that meant that I had to remain silent in the face of enormous and personal, painful criticism from people who I knew and loved, who I thought knew and loved me. But then that's the way it played out. And so my solution was silence. I had to weigh these different feelings that I had, and I chose to remain silent because I knew that a lot of PEPFAR in the ability to get PEPFAR through and through the White House and to get him to support it had to do with a personal relationship I had with President Bush and his trust in me that I would have his back. So as you consider your careers, you are going to be handed your own moral equations to solve. We live in a country, you might not know it sitting here in Berkeley, but we live in a country that is very, very divided politically and very closely divided. If you go into the public sector, if you go into work in public health, if you want to have a big impact in the world, you're going to have to compromise. And if you compromise, that means you have to make choices about things you may, like I did, about things you really feel strongly about and things that you may value. You may challenge to weigh your feelings against your values, and you may have to make a hard decision. So if you aren't sure of your values, if you haven't spent some time thinking about your values, and you talked about roots earlier, if you haven't looked into the roots of your values, where do they come from? They come from your family, religious background, philosophy, from UC Berkeley. But know what your values are and know where they come from, because the compromises, the outcome of the compromises you may make will make or break your career and will make or break the world. So here's my advice to you on this happy occasion. And again, congratulations to all of you. Do the hard work necessary to understand, to clarify, and to articulate your values. Remember that values are less about the strength of your feelings than they are about the strength of your character to act on them. And finally, I believe that spiritual fortitude is essential in all of this. Work on cultivating that too. Thank you very much for this award.
Hi everyone, my name is Tia Gangopadahe, and as we honor our Alum of the Year, I wanted to take a moment to share that by virtue of graduating from UC Berkeley today, you automatically join the illustrious Berkeley Public Health Alumni Association. We host professional development webinars, innovation challenges, alumni mixers, virtual lectures, career workshops, and much more. Please scan the QR code on the back of your program to update your contact information so that you can stay connected with us no matter where your pursuits take you. Join to support, to educate, and to lead with a growing community of public health changemakers like yourselves. Membership is entirely free. It is my distinct honor as Alumni Board President and very proud double bear to welcome you all to the UC Berkeley Public Health Alumni Association. Congratulations, graduates of the undisputed #1 public university in the country. Go Bears.
Thank you, Tia. I now have the honor of introducing our commencement speaker, Dr. Sue Desmond-Hellmann. Dr. Desmond-Hellmann is a physician scientist whose career has transformed cancer care and global health. At Genentech, she helped pioneer breakthrough medicines, including 2 of the first targeted therapies for cancer, Avastin and Herceptin. She then served as the chancellor of the University of California, San Francisco, the first female chancellor at UCSF, leading one of the world's premier health sciences institutions. And as the CEO of the Bill and Melinda Gates Foundation, she led 1,400 colleagues working in over 100 countries to improve health and save millions of lives worldwide. Please join me in welcoming Dr. Sue Desmond-Hellmann to the podium.
It is my honor to address all of you, Dean Liu, faculty, friends, and family, and most especially the esteemed graduates. I know it's late and you're hot. You'll get your diploma soon. UC Berkeley School of Public Health, class of 26, congratulations. Public health is not a luxury. It is challenging to imagine an everyday activity that's not better and safer because of public health. From the moment we wake up and brush our teeth with clean water to the enjoyment of a bowl of cereal with pasteurized milk, public health is there for us. Who here could imagine a world where we once again see physicians advertising cigarettes or experience repetitive exposure to secondhand smoke? I know that I drive with more confidence knowing that I have on a seatbelt, and the other drivers on the road know not to drive drunk. This daily confidence in our safety is a direct result of public health. Public health is not a luxury. As you just heard, I began my medical training in San Francisco right when AIDS hit San Francisco. HIV caused destruction of the immune system. This deadly infection had an outsized impact on gay men. Prejudice kept the pace of needed progress too slow. I remember President Reagan wouldn't say the word AIDS, but activism led to action. Public health, along with American generosity, enabled one of the most consequential public health programs in modern history, and I just got to sit next to the guy who made it happen, Joe O'Neill. PEPFAR was launched with incredible scale and ambition at a time when HIV/AIDS was devastating entire countries, especially in sub-Saharan Africa. That ambition translated to 8 million babies born AIDS-free. And as you just heard, 26 million plus lives saved. Now, no big public health program is perfect, but I would argue that public health at this scale is a beautiful thing. Public health is not a luxury. Creativity in public health means using policy and dialogue to form new partnerships that can challenge business as usual. My personal favorite public health program, Gavi, the Global Vaccine Alliance, put together non-governmental organizations, philanthropy, vaccine manufacturers, and local governments with a singular goal: making sure that where a child is born does not determine whether they have access to life-saving vaccines. Now, if you like business, this unique partnership leveraged pooled demand and long-term financing commitments to get vaccines to the poor. More than 1 billion children have been vaccinated. That's right, that has a B. More than 1 billion children have been vaccinated. And we estimate about 17 million deaths have been averted because of Gavi. The world is safer and the world is more fair because of Gavi. Public health innovation can mean inventing better systems for delivering interventions equitably. Now, as you can tell, I could tell great public health stories all day, but I won't. Even as we sit here today, a small hantavirus outbreak has global health experts scrambling to understand the spread of hanta and interfere with further transmission. Now, I put together my talk too early to start talking about Ebola, but there's Ebola too. An effective public health system gives us confidence to carry out our everyday activities: brushing our teeth, driving on the road, breathing the air. But a public health system that works also provides a rapid response for new health challenges. Whether it's an infectious disease, global warming, or air pollution, a health threat anywhere is a health threat everywhere. Okay, if you guys, you're probably getting worn out here. If you remember one line from me: America cannot be healthy without a continuous, sustained commitment to public health. I'm going to get that tattooed. I'm threatening it. Graduates, you know how important public health is. You don't need me to tell you. That's why you're here. And that's why you, along with your great faculty, have worked so that you acquire the knowledge and skills you need to keep the world safe. I graduated from UC Berkeley School of Public Health nearly 40 years ago. I got that, alum. Here's what I would tell you, and I'm delighted to report that I used the skills I learned at UC Berkeley School of Public Health, studying AIDS and cancer in Uganda, developing medicines in pharma and biotech, leading UCSF as chancellor, and serving as the CEO of the Gates Foundation. These are really good skills, you guys. Yeah, you go. I know many of you are asking the question, how can I use my public health degree from one of the best universities in the world to go into the 2026 job market? Or as my late beloved dad used to say, so you got an MD and an MPH, now you need a JOB. Does that sound familiar? I know it's traditional for commencement speakers to give advice. You've heard a lot of really good advice today, but I want to tweak that tradition just a little bit. Given my background, I thought I'd let you know how I make decisions on who to hire and who to promote, something I hope is helpful, especially in today's job market. So first, imagine this. You're sitting at a table filled with colleagues, and they tell you that they're going to divide into small groups. I don't know about you, but when that's happened to me, I look around and I think, oh, I hope I'm with them. I hope I'm with that person. You immediately know the person you want to work with. Immediately. And here's an idea. Be like that person. Be that person everybody else wants to work with. But ask yourself to start, what makes it so appealing to work with them? And even more importantly, what's it like to work with me? A few thoughts on that. First of all, be technically great. UC Berkeley credentials are worth a great deal. I always light up when someone tells me they have a degree from UC Berkeley. Even better is you backing up those credentials by demonstrating your understanding of inference, statistics, epidemiology. Your ability to understand and utilize data, ask the right questions, and contribute to clarity on the best course of action matters most. It sounds obvious to emphasize continuous learning, but it's for real. Keep reading, keep learning, and be generous in mentoring or helping others. That's a great way for you to keep up your own skills. You can't teach it if you don't know it. Being technically great only matters if you can communicate your insights effectively. Work hard at being understood. Secondly, public health is a team sport. Show up with respect for others, offer to help, and show that you know when to lead and when to follow. By the way, the team sport part of public health can be challenging, but it's always fun. Make it a point to figure out what you enjoy about each of the folks you work with and demonstrate respect by actively learning from colleagues. Third and final one, manage yourself. In medicine, we have a saying, when there's an emergency situation, take your own pulse first. Do you get it? Take your own pulse first. I know I can't help others if I'm a mess, and I suspect you feel that way too. Like you, I have a passion for public health. I love the work. In the face of a public health emergency or a struggling community, it's tempting to overwork or overstress. You're all public health experts, so you know the value of sleep, a healthy diet, exercise, and good relationships. Taking care of yourself means you show up with energy and enthusiasm and let you lift up your own spirits and that of others. Now, graduates, as I end, I hope you know by now how much I love public health and how much the world needs all of you. Your excellence, your energy, your commitment, and your values are critical for the future of public health. I want to give you one last challenge. So too frequently in health, we overemphasize individual benefits. For example, we overemphasize individual benefits from a vaccine, and we undervalue community benefits. You're graduating into a world that has glam ups, looks maxing, and influencers. I'm glad you knew what that meant. You know what I mean. In this kind of me environment, I want you guys to challenge that balance, ensuring that public health's emphasis on broader benefits to communities and populations are seen. If we get that balance right, if you get that balance right, that's the best chance for all of us to lead healthy and productive lives. I wish all of you the best for success, no matter where your UC Berkeley degree takes you. I, for one, can't wait to see what you will accomplish. Thank you, and congratulations.
Thank you, Dr. Desmond-Hellmann, for those absolutely inspiring words, and thank you for all that you do for healthcare and public health. And I hope you see that We just had 2 examples of UC Berkeley School of Public Health graduates who changed the world. So let's give it up one more time for Dr. Sue Desmond-Hellmann and Dr. Joseph O'Neill. Now we've come to the part of the ceremony that you've all been waiting for, the conferral of degrees. I'd like to ask our faculty directors to please come forward for the presentation of our graduates. And I'd like to ask all of our graduates and families to please stay until the end of the ceremony. Every student walking across the stage has worked incredibly hard to get here, and they each deserve to be celebrated. Let's honor every single one of them all the way till the end of the ceremony. That's the Berkeley way. Plus, the reception food line won't open until after the ceremony is over, so no point to trying to beat the rush.
Dean Liu, it is my pleasure to present the following students who are receiving a degree in Doctor of Public Health. Juan Carlos Bordes, with a dissertation title under Advancing Emotional Health Equity, Structural Approaches to Sustaining the Well-Being of the Occupational Therapy Workforce. Their dissertation co-chairs are Dr. Hector Rodriguez and Dr. Emmeline Chuang. They are being hooded by Dr. Rodriguez. Marisol de Ornelas, with a dissertation title under Reimagining Perinatal Care to Advance Maternal Health Equity, a mixed method study of a community-centered care model and postpartum depression prevention. Their dissertation chair is Dr. Juliana Deerdorf, who is hooding them jointly with Dr. Kim Harley. Ravneet Gill, with a dissertation title under Data Disaggregation to Advance Equitable Breast Cancer Prevention for Asian Americans. Their dissertation chair is Dr. Hector Rodriguez, who is hooding them. Ruseline Gomez Cifuentes, with a dissertation title under An Analysis of Novel Person-Centered and Rights-Based Measures in the Contraception Field. Their dissertation chair is Dr. Ndola Prata, who is hooding them. Bhavya Joshi, with a dissertation title under Reaching the Furthest Behind First, Reproductive Health During Compounded Crises in Kenya's Refugee Settlements. Their dissertation chair is Dr. Ndola Prata, who is hooding them. Monica Parimi, with a dissertation title under Matrescence, Metabolic Risk, and the Life Course, addressing racial and ethnic disparities in diabetes risk after hypoglycemia in pregnancy. Their dissertation chair is Dr. Cassandra Marshall, who is hooding them. Nadia Rojas, with a dissertation title under Voices from the Fields, Sleep, Cognitive Function, and Social Determinants of Health Among Latinas in an Agricultural Community. Their dissertation co-chairs are Dr. Jacqueline Torres and Dr. Juliana Deerdorf. They are being hooded by Dr. Torres.
Dean Liu, it's my pleasure to present the following students who are receiving a degree in Doctor of Philosophy in Biostatistics. Maggie Kaying Kwan, with her dissertation title under Statistical and Computational Methods for Interpretable Analysis of High-Dimensional Data. Their dissertation chair is Dr. Elizabeth Purdom, Who's hooding them? E. Lee, with her dissertation title under Regularized Targeted Learning, under Analytic Intractability, Project and Guided Targeting and Grouped V-fold Jackknife Inference. That's quite something. Their dissertation chair is myself, Mark Vendelaan, and I'm hooding them. George Shan, with a dissertation title under Development of New Estimators and Applications in Genomics using Targeted Maximum Likelihood Estimation. Their dissertation chair is myself, Mark Vendelaan, and I'm hooding. Xuede Shen, with her dissertation title under Facets of Nowcasting, Latency, Revision, and Uncertainty Quantification. Their dissertation chair is Dr. Ryan Tipshirani, and I'm hooding them. And Wen-Xin Zheng, with a dissertation title under Targeted Learning for Adaptive Experimentation and Data-Driven Decision Making. The dissertation chair is myself, and I'm hooding them.
Rosemary? There you go, sorry. You're good.
Dean Liu, it is my pleasure to present the following students who are receiving a degree in Doctor of Philosophy in Environmental Health Sciences. First, we have Simon Kompanuri with a dissertation title under Statistical and Machine Learning Approaches for Understanding Infectious Disease Dynamics in Response to Environmental Changes, Applications to Emerging Fungal Diseases. The dissertation chair is Dr. Justin Remay, and they are being hooded by Dr. Ellen Eisen. Dean Liu, it is my pleasure to present Laura Margaret Diaz with a dissertation title under Examining the Role of Mitochondrial DNA in the Biological Embedding of Childhood Adversity and its influence on atopic disease risk in a predominantly Black and Latinx pediatric cohort. Their dissertation chair is myself, Dr. Rosemary De La Rosa, and I will be hooding her.
Go Berkeley Public Health! Woo! All right, Dean Liu, it is my pleasure to present the following students who are receiving a degree in Doctor of Philosophy and Epidemiology. Julia Acker, with a dissertation title under Embodying Inequality in Adolescence, Racialized Patterns of Mental Health and Pubertal Development across place and time. Their dissertation's co-chairs are Dr. Mahasin Majahid, myself, as well as Dr. Juliana Deerdorf, and we are hooding them. Caitlin Shaolin Chan, with a dissertation title under Examining the Structure of Neighborhood Violence and Pathways of Embodiment on Intergenerational Health Among California Births from 2007 to 2018. Their dissertation chair is Dr. Jennifer Ahern, who is hooding them. Sylvia C. Chang, with a dissertation title under Advancing Precision Health Through Robust Statistical Methods, Leveraging Causal Inference and Uncertainty Quantification in Epidemiologic and Clinical Research. Their dissertation chair is Dr. Barbara Laraya, and they are being hooded by Dr. Alejandro Schuler. Saron Goitam, with a dissertation title under Violence, Segregation, and Health Across the Life Course, Measurement and Early Life Impacts. Their dissertation chair is Dr. Jennifer Ahern, who is hooding them. Emily Futing Liu, with a dissertation title under Epidemiologic Evidence of Community Violence and Women's Health, Trends, Disparities, and Mediating Pathways. Their dissertation chair is Dr. Jennifer Ahern, who is hooding them. Isabel Munoz, with a dissertation title under Social Disparities in Attainment of Pregnancy Preferences or Poor Measurement, an examination of unintended pregnancy using the Desire to Avoid Pregnancy scale. Their dissertation chair is myself, Dr. Mahasin Mujahid, and they are being hooded jointly by myself and Dr. Kareen Roca.
All right, Dean Liu is not ready yet. Hey, Dean Liu. It is my pleasure to present the following students who are receiving a degree in Doctor of Philosophy in Health Policy. Qi Jiang, with a dissertation title under Early Childhood Development and Caregiver Mental Health in Rural China, Evidence from Intervention and Implementation Studies. Their dissertation chair is Dr. Leah Fernald, and she is being hooded by Dr. Will Dow. I'm pleased to present Alex Schulte, with a dissertation under How Do Religious Directives Affect Hospital Operations, Access to Care and Patient Outcomes, Evidence from U.S. Catholic Hospitals. Their dissertation chair is Dr. Amanda Brewster, who is also hooding her. And finally, we have Irfan Sai, with a dissertation title under Essays on Programs and Policies to Support Child, Caregiver, and Family Well-Being. Their dissertation chair is Dr. Leah Fernald, and she's being hooded by Dr. Will Dow.
Dean Liu, it is my great pleasure to present the following students who are receiving a Doctor in Philosophy in Infectious Diseases and Immunity. Carolina Agudelo, with a dissertation title, The Impact of the Gut Microbiome on Respiratory Pathogens. Her dissertation co-chairs are Dr. Ashley Wolf and Dr. Sarah Stanley, who are jointly hooding her. Elias Duarte, with a dissertation title, The Antigenic Landscape of Dengue Immunity, Epitope Specificity, FC Function, and Correlates of Protection and Risk. His dissertation chair is myself, Dr. Eva Harris, and I am hooding him. Desmond-Hellmann with a dissertation title, Mechanisms of Vascular Leak Triggered by Viral Pathogens. His dissertation chair is myself, Dr. Eva Harrison. I am putting him.
From Mark. Mark? Marco. Mark Anderlin. Great. Mark. The masters.
Oh, okay. Where's the list? Dean Liu, it's my pleasure to present the following students who are receiving the degree of Master of Arts in Biostatistics. Emily Yu. Senkipo Nyaluvu. Dirk and Tony Tolson, 3. Yutin Wu. Jordan Prather. Is that it? Yeah.
Charlotte. Charlotte. Start here. Dean Liu with the Master of Public Health.
Dean Liu, it is my pleasure to present the following students who are receiving the degree Master of Public Health and Environmental Health Sciences. Deborah Singtong Chun. Alejandro Fabian. Parisa Kavusi. Dhruv Patel. Mariah Angelrisa Basilroy Peralta. Alexander Benoit Shing. Stella Shuyi Wang. Yi Peng Wei. Jane Nguyen. And the degree of Master of Public Health and Environmental Health Sciences, Industrial Hygiene. Jamie Lynn Gonzalez Baranda. Ashley Koshans. Vanderhoop Persad. Sarah Tepler. Yitang Tien.
and the degree of Master of Public Health and Global Health and the Environment. Lily Barak. Sophia Heron-Geller. Alicia Chi. Douglas Kramer. Amy Kuriakos. Yishun Lin. Gabrielle McGinty. Chloe Ortiz. That's it.
It's me again. Go public health families. Woo! Dean Liu, it is my pleasure to present the following students who are receiving the degree of Master of Science in Epidemiology. Jessica Arbuckle. Aaron Dew. We're the 11 months. The 11 month. Right, but he's an 11 month. He's a different student. Okay, Dean Liu, it is my pleasure to present the following students who are receiving the degree of Master of Public Health and Epidemiology, 11 month, Gilberto Osuna Leon. Nathra Srinivasan.
Dean Liu, it is my pleasure to present the following students who are receiving the degree of Master of Public Health and Epidemiology and Biostatistics. Gillian Jide, Austria. Nakaya Frazier. Isaac Frimpong. Shreya Gautam. Grace Gundy. Nyla Hassan Warren. Junting Ha. Ningji Ha. Katrin Heine. Ma'am Rohea Jack. Adam Kasdan. Nieka Zardinian Modoshemi. Osaje Oya. Claire Payne. Raquel Argentina Richardson. Hannah Rishik. Eda Yilmaz. Cynthia Yu.
It's me for the last time. Go Public Health, staff and faculty. Woo! Dean Liu, it is my pleasure to present the following students who are receiving the degree of Master of Public Health in Epidemiology and Biostatistics, 4+1. Juliet Delcourt. Audrey Coe. Aiden Lee. Katie McDermott. Andrew Pereira. Brittany Lee Nguyen. Janelle Sue. Caitlin Subijanto. Serena Wang.
Dean Liu, it is my pleasure to present the following students receiving the degree of Master of Public Health in Health Policy and Management. Lucas Grant Kalika. Meriden Castrens Chia. Anya Fong. Glenn Gebremeskel. Sylvia Kimwe. Cassidy Kirk. Isabel Knowles. Ratu Orisi Lalabalavu. Maida Lohani. Jessica McLaughlin. Sofia Moreno. Noah Palafox. Keegan Schroeder. Claire Schutz. Hannah Silber. Devin Sternberg. Swapnika Tantravahi. And Svetlana Tauzhianskaya. Mintram Tran. And the degree of Masters of Public Health and Masters of Business Administration in Health Policy and Management. Jennifer Lamb. And the degree of Masters of Public Health and Masters of Public Policy in Health Policy and Management. Cynthia Alvarado Martinez. And Bruce Arau.
Dean Liu, it is my great pleasure to present the following students who are receiving the degree of Masters of Public Health in Infectious Diseases and Vaccinology. Justin Chikotao. Catherine Cole. Jiachan Dong. Kaya Duncan. Stephanie Fruth. Riley Michelle Hagerman. Merab Hussein. Valeria Landa Rosales. Natalia Ali Masami. Alma Gua Abbott. Mario Orantes. Steven Palomares. Nabil Razi. Oleander Redmond. Adia Inés Robles. Belangani Tatiredi. Grace India Tulsi. Miley Elizabeth Wood. Hanson Chow.
Dean Liu, it is my pleasure to present the following students who are receiving the degree of Masters of Public Health in the Interdisciplinary Program. Akila Chilakala. Jackie Chu. Tiffany Francisca. Maxwell Ho. Kai Wang. Patrick Wynn. Veronica Juguna. Katie Pham.
Dean Liu, it is my pleasure to present the following students who are receiving the degree of Master of Public Health in Health and Social Behavior. Grace Allensworth Brown. Theodore Russ Bussell. Marnell Nicolette Cruz. Nuran Usama Fadl. Hannah Lillian Fishbein. Alisa Ting Leon. Yu Ma. Edwina Marial. Dante Angel Tivas Miguel. Haley Elise Newman. Francisco Javier.
Jeremy Esteban Rodriguez. Marnie Shabash. Eleanor Simic. Sierra Chantel Simmons. Berenice Tago.
Dean Liu, it is my absolute pleasure to present the following students who are receiving the degree of Master of Public Health in Maternal, Child, and Adolescent Health. Kira Beltran Murillo. Gianna Footman. Noemi Burgos Franco. Nare Hurutyonyan. Yay. Chloe Hood. Anjali Leela Jain. Sydney Ann McFadden. Talia Neely. Tao Ni Phan Nguyen. Jordan Rand Mulitupele. Samantha Tapia. Aguirre Cabadu Techale. Yuna Tomimasu. Emily Ward. Mackenzie Warren McGraw.
Dean Liu, it's my pleasure to present the following students who are receiving the degree of the Master of Public Health in Food, Nutrition, and Population Health. Catherine Bowman. Woo! Victoria Brown. Joyce Chan. Catherine Ford. Fanaz Koilu. Shah Ports. Claire Young. And the degree of Master of Public Health in Food, Nutrition, and Population Health, Dietetic Intention. Go, Tanya Amador. Victoria Alejandra Garcia. Jairo Guzman. Tiffany Lay. Zoe Tanner. Yunli Wang.
Rebecca Schill.
Dean Liu, it is my pleasure to present the following students who are receiving the degree of Masters of Public Health in the online program, Epidemiology and Biostatistics. Juliana Barros Viruk. Chin Chen. Aaron Curley. Rahel Gatane. Leah Gibbs. Maria Camila Gonzalez Rocha. Alexis Grisham. Tawana Gross. Madeline Hill. Lucien Leffer. Audrey Lopez Valdez. Angela Mackey. Emily Montenegro. Pamela Pichon. Clarissa Ann Sandvik. Valerie Stacy. Brooke Stimmel. Ash Stivers. Anna Turzo. Samya Varadarajun. Ariana Waters. And Olivia West.
Dean Liu, it is my pleasure to present the following students who are receiving the degree of Master of Public Health in the online program, Food, Nutrition, and Population Health. Patrick Arceo. Taiwana Atkinson. Audrey Tumai Connell. Jasmine Dominguez Ramirez. Hannah Genther. Giselle Zuniga. Diana Jackowitz.
Dean Liu,
it is my pleasure to present the following students who are receiving the degree of Master of Public Health in the online program, Health Policy and Management. Rihanna King. Lisa Henderson Stone. Oliver J. Gonzalez Bobadilla. Melissa Geach. Gabriela Garcia Ruvalcaba. Kenneth Chan. Mohammed Ayman Azizuddin. Keelani Marie Morris Cletty. Jenny McCoy. Kalisha McClendon. Ruth Watu. Mona Lisa Nenzwa. Ken Park. Michelle Sines. Teresa Schinder. Andrew Tyler. Clara Wu.
Dean Liu, it is my absolute pleasure to present the following social change professionals who are receiving the degree of Master of Public Health in the online program, Interdisciplinary. Anna Campbell. Laura McMaster Dean. Barbara Gabriel. Jessica and George. Abigail Gertie. Kelsey Giroux Mall. Lisbeth Gonzalez. Sukanya Govindan. Roxanne Kelly Greenstreet. Megan Irene Gregg. Juliana Wenjing Guo. Hannah Hassler. Kimberly Haverly. Caleb Kelleher. Amelia Lipscomb. Lopez. Keisha Madison. Hannah Miller. Celine Marie Olson. Ana Ortiz Ramos. Christy Palomares. Bianca Patino. Kim Pinto. Pamela Ros Ramos. Eric Cortez Rangel. Mónica Romero. Rosenity Rose. Cassandra Silvestri. Yinchin Song. Kaleni Michael Tukia. Miriam Vireya. Kara Waples. Aaron Michael Winden. Virginia Robo. And Ethan Yao. Yay, online. So congratulations to our graduate students. Please be sure to retake your seats in the theater as we honor our undergraduates next. After they have had the chance to cross the stage, Dean Liu will confer your degrees, and we will all celebrate as you turn your tassels. After the conferral of degrees, we welcome you to attend the reception under the campanile, which starts after the ceremony here at the Greek has finished. Congratulations.
Congratulations to all of our doctoral, master's, and MPH grads. Next up, we will begin the conferral of degrees for our undergraduate students. And again, we ask that our audience please remain seated until all the undergraduates' names have been announced. Thank you.
Millie Kaur Batra. Catherine Jae-yun Chen. Bianca Chiu. Shreya Gunda. Mandy Huang. Elena Lee. Rachel Jean Lee. Helena Liu. Trisha Sengupta. Emily Sai. Jason Abarca Gomez. Abigail Abraham. Jude Abugalia. Maria Adame. Prathana Adhikari. Anushka Adusumali. Misha Afnani. Destiny Aka. Anisa Israt Alam. Alec Alvarado. Jimena Alvarez Gallegos.
Sabah Amin.
Haya Ansari. Aaliyah Desiree Arayanes. Piero Arienti. Daniela Isabel Areola. Ava Nicole Axelson. Ghassan Bassem Azize. Yasmin Baker. Jasleen Kaur Ball. Samantha Celeste Beccaria. Estefany Behar. Ayushma Bandari. Haley Sharon Burns. Uriel Cardoza. Reina Victoria Cedillo. Destiny Bridgetney Seha. Crystal Antoinette Chrysologo Chu. Rachel Chung. Catherine Ann Clark. Adolfo Correa Reveles. Alexa Cortez. Sadie Annalie Curiel. Grace Catherine Delarda. Anvi Damani. Alana Maylene de la Cruz. Trisha Dev Chowdhury. Santiago Azad Doherty. Jaina K. Doshi. Vane Michelle Dueñas. Jackson Engler Carlson. Catherine Flowers. Evelyn Carolina Fontan. Ava Fu. Carla Imelda Fuentes Martinez. Francis Allison Gabrielli Di Carpeña. Francis Allison Gabrielli Di Carpeña. Q Lin Go. Evelyn Raquel Gia Flores. Lavanya Gupta. Isabella Faith Hay. Maya Hernandez. Maya Elizabeth Hernandez.
Wilton Lawton.
Matthew Ho. Tiffany Hoang. Wen Yue Ho. Ryan Shu. Lisette Huerta. Taylor Blue Hufford. Kathy Huynh. Maya Alessandra Ibarra. Arjun Ramesh Jadhav. Sanjam Jaj. Shreya Jeriwala. Joelle Marina Jones. Kimberly Gabriella Julian. Matthew Kang. Mia Isabel Casalag. Aisha Khan. Hannah Caitlin Kim. Sean Jason Kim. Neha Shirsagar. Sunwoo Kwak. Adinath Paul Wayne Lane. Yuan Lei. Paloma Leal Perez. Vincent Lee. Taven Rose Del Fierro Lemon. Mariana Leyva. Audrey Liang. Tian Run Lu. Dulce Alicia Napoles Loreto. Lana McCarram. Crystal Olenka Mantia Ulloa. Sara Matu. Samira Menon. Sophia Elizabeth Miraco. Juliette Maureen Moschetti. Jaita Mukunda. Ira Ali Mumtaz. Annika Hiwon Nam. Allison Wynn. Ivan Nguyen. Tian Nguyen. Rebecca Sage Noble. Ton Nip Ong. Araceli Guadalupe Orozco. Fian Imawahen Osahan. Gracie Osborne. Shrida Pandi. Patricia Fonseca Perez. Han Pham. Kimberly Fung Pham. Michelle Lee. Caitlin Kat Nee Win. Caitlin Vivian Knopp Pham. Alern Fun. Shrujana Paluri. Ainsley Porter. Catalina Yu Quach. Sumya Rai. Michael Dominic Ramirez. Akash Bellam Reddy. Lila Richmond. Sophia Anjali Roy Berman. Alea Belarde Rubin. Lindsay Rose Ryan.
Aushleen Kaur Sahota. Tamara Casilla Sanchez. Vanessa Sanchez Asuncion. Lily Anaí Sanchez Lopez. Ariya Savla. Cornelia Julia Scott. Min Ju Shim. Anya Sikuri. Kasturi Sinha. Edwin Tehun Song. Kristen Song. Maturi Suresh. Amina Mohammed Sadek. Eileen Tam Ta. Aaron Soyan Tak. Sophia Amalie Songko Tong. Nancy Hong T. Mega Thomas. Amanda Z. Tran. Carolyn Tran. Karina Tu. Kimberly Melissa Vaca. Ariana Adelina Valle Potea. Ariane Maris Vidal. Samantha Vieira Nahar. Maggie Watts. Emily Yang. Kaylee Yang. Karis Yoon. Nevaeh Janae Woods. Calvin Young. Ethan Jiajun Ye. Anna Rose Irungori. Charlotte Zhang. Emma Yi-Jen Zhang. Serena Zhang.
Now is the time to make all of your degrees official. Will all the graduates please rise? By virtue of the authority vested in me by the President and the Chancellor of the University of California, I grant you the degree of Doctor of Public Health. Doctor of Philosophy, Master of Arts, Master of Science, Master of Public Health, and Bachelor of Arts. You can take your tassel and move it from the right to the left. Please join me in congratulating this amazing class of 2026 of UC Berkeley School of Public Health. This concludes our ceremony. After the recessional, please join us for a reception in honor of our graduates at the Campanile Esplanade. To lead the way, the UC Straw Hat Band is waiting just outside the march, us down the hill. We invite you all to follow the music to the Campanile for a light reception where our beloved Oski the bear will be waiting to take photos with you. Will the faculty and all of our guests please rise? We are going to let our graduates exit first, and let's give them a standing ovation as they go out into the world to fight for health equity and social justice for all. Congratulations, graduates. Go out there and make us proud. Fiat Lux and go Bears!